I'm Dr. Philip Omenschneider at the Ozark Chiropractic Clinic, and I'd like to welcome you to our video today. I want to do a continuation of our last video. We talked about infants and babies, more treating children. And I think I concentrated more on just the younger ones like that. And while we do treat a lot of babies and infants, I see really most kids that I see are probably aged in the grade school to junior high to high school age. And so what are some of the common problems that we see that children present with? Well, headaches is by far one of the most common things that I'll see. I generally see it more in girls, and I think especially when they start to hit their menstrual cycles and the body's changing, that's very much involved with headaches and going on. They respond very well to care, but guys also do too. Migraines is something that we see a lot of in children. Sinus issues. And then we've got your general run-of-the-mill neck pains, back pains, hip, leg pains and things. We see a lot of kids who get injured as they get older playing sports. So we take care of those injuries, whether it's from football, basketball, volleyball, injuries that will occur from there. And what's great about children is they respond so fast to care, and they're really so much fun to take care of. A couple of tips we can have for parents. If your kids are carrying a backpack, okay, make sure that the pack is up higher on their back. You don't want to have it slung way down low because that pulls back on you. So you want it up to the upper middle part of the back. So make sure the straps are up higher and they're holding the weight up higher. And then check too how much they've got in the thing. Don't overload it, okay? Another thing is phones. Texting, looking at phones. We all see it. You look at around every day, you'll see adults doing it too. We're like this, right? Looking down, looking down. Look at the stress that puts upon that neck. You do that a lot all day, that hurts if you're in a class. So what I try to do is start to hold things up. You don't have to hold it up right up to here, but if you hold it right to here, your gaze can go down and your neck doesn't really have to move much. So that helps to prevent text neck, as we like to call it. So that's something simple there. But kids respond really well to care, and don't be afraid to ask them what's going on, because I know as a parent, I've had this too. You know, your children come in, they say, oh, I hurt myself, I did this. You look at me, you're fine, right? We've all done that. But then they'll come back, you know, maybe a week later, hey, it's bothering me still, it's hurting. Oh yeah, you're all right, whatever. And then they keep coming back. Listen to them, talk to them. That'd be the most important thing, is really sit to ask them, say, okay, when does this hurt? How long has this been going on for? What seems to make it worse? Is it affecting you? So really ask them and see what answers you get from them. Because I don't think most children are out there, you know, just to get attention and want, you know, your attention because they're hurting or something. They're only going to come to you if they've got a problem. And I know as a parent, you don't want to feel bad. Think, oh my kid had this problem and here I ignored it. So sit down, talk to them, listen to them. And such. Kids, like I say, they're a joy to treat. They respond to care so quick and easy. And that's something that, you know, don't overlook your children. They do get problems. They do things to themselves as they're growing and developing. And this is going to help their bodies grow and develop better, because what happens now can affect them down the road too. So as usual, if you have questions, you can call me at 667-5053. Reach us on our website, ozarkchiropractic.com. Share the video, like us. I'm here to help you any way we can. I look forward to seeing you in the future, and I'll wish you a great day. Thank you very much.